Well, I'm here at my sister's. I'm doing her laundry. Right now it's in the dryer, thankfully. It's been getting hard for her, trying to take care of two kids, and then you have the toddler that's constantly yelling, and, being a toddler, a 3-year-old. Dad's got him right now. Well, I'm making this as an update. It is Saturday. I don't remember the day. But, both my dad and my sister do not agree with me having the urostomy, but I think I'm going to go through with it. I'm tired of losing sleep because I'm constantly running back and forth to the bathroom. I'm just tired of it all, considering every time I use cath, it's causing issues to my bladder. And enough's enough for me. And they don't have to deal with it. They don't know what it's like. It's a problem. And the doctor wanted to try as he put it, it's like a pacemaker that hooks up to your nerves, to your bladder and bowels. And I'm like, I do my research, I watch videos, I watch surgeries. And that area where they put it, I already have enough pain because that's exactly where they first found that I had MS. And the pain, I can tolerate it, but at times it does become excruciating. I don't even want to touch the area, and that's where it goes. And I'm just like, no. I even spoke with a friend who had the bladder reconstruction, and she's like, don't get that one. But I know every patient is different, but I'd rather live my life with a bag and not having to worry about having to run to the bathroom, just having it attached to a night bag or whatever. But probably gonna do that. I just hope the MRI doesn't show any drastic changes or anything, because I have been experiencing a lot more dizziness, walking issues. My fault, because I don't like using my cane, and I don't like putting on my braces for my feet because it hurts a lot. Although it's supposed to help, yada yada. Don't want it. Put my niece to sleep. They had to change her formula, like me and her brother, and I think their dad too. We all have lactose intolerance, so they had to change her formula because she was experiencing everything that you get when you're lactose intolerant, which is diarrhea or constipation, super gassy, fussiness. But that could be also, my sister says reflex, but we all have GERD. I do mean all of this. Carlito had it too when he was a baby. Around the same time as her, because she's already 4 months old. But I'm just trying to hang in there and get this figured out. Get things done that I need to get done. And the other day, Friday, I took the day and I cleaned my bathroom. I breaded salmon, fried it, made some vegetables, made some rice. Just a day for me. But sometimes you have to do what you have to do when you deal with this illness. And for me, on the plus side, they take out my uterus, which would help with all this, because it's also a treatment for polycystic ovary syndrome. Never been told that, but I did research it, and I'm like, go ahead and take it. I'm not looking to have any kids. I'm good. I am tired already, always fatigued, and I don't mind spoiling my niece and nephew with mostly clothes, because she is growing out her clothes. She's wearing, I don't know if the material is small, but she's wearing 9-month clothes. She weighs more than 20 pounds. She's got to. But Like I said, once she starts moving, she'll lose it. But she also has a chance of inheriting PCOS, which, from what we know, comes from our mother's side. It doesn't, no trace of that in my father's side. The only thing we know from him is that my grandfather had schizophrenia. I think. He wasn't diagnosed. He's like my dad. He never liked going to the hospitals. He died when I was a baby, but just by the way my dad says he treated them, something wasn't right. I say that. I mean, me myself having, was it dysphonic? I was recently diagnosed a couple months ago, last year, which just a fancy word of saying that I have depression that doesn't go away. You know, just gotta deal with it, take my medicine like I'm supposed to, and you gotta keep living, right? And thankfully I tested negative for COVID. My sister and her family all tested negative for COVID. Don't know if they had tested my dad for COVID when he went to the emergency room. Possibly. But he always says his coughing and sneezing is due to allergies, but I don't know. I always worry about that, especially when he's around the grandkids. But I can't take care of him, I gotta take care of me.